You're dealing with an arthritic hip patient. Very common with hip joint arthrosis in all phases of arthritis is weakening of the gluteus maximus muscle, weakening of our main hip extensor muscle. There's a number of different positions and a number of different exercises where we can get good strength building for the gluteus maximus. One of our most basic exercises, which is applied in many different venues of practice, is the hook-lying bridging exercise. So let's take a quick review of that. Make sure your patient's neck is well supported and that they're comfortable and able to breathe well in this position. Have the patient take a little bit wider base of support, so spread their feet out just a little bit, okay? And then have them use their quads and their proximal hip extensor muscles to drive up into a bridge position. This exercise can be held isometrically or performed isotonically. And with all other therapeutic motions, make sure that you choose an amplitude or an arc of motion that's comfortable for your patient's hip joint. If the patient runs into hip discomfort, continue the exercise with a smaller amplitude. If they're able to fully extend, that's great, as long as there's no discomfort in either the hip or the low back, because keep in mind that not only does this particular exercise strengthen the gluteus maximus muscle well, this is also one of our basic lumbar stabilization exercises that strengthens the lumbar multifidus muscle. That can be a very good thing, but in cases of severe degeneration of the lower back, end-range hook-lying bridging sometimes causes too much muscular base compression in the lumbar segments. So again, make sure it's comfortable for your patient's hip and their lumbar spine.